an executive assistant, a grandmother, a call center employee, and a housewife. 4 women. 4 different women with one common problem. They all have dry eye.
Well, dry eye is a condition where the tear film of our eye is abnormal. Now, it can be that the tear film is insufficient, so you don't have enough tears. But we're learning after many years of research and knowledge that dry eye is a little bit more complicated than that.
In a way, yes, there's decrease in tear production, but mainly it is because of inflammations in the eye. So these inflammatory factors are the ones that causes irritation and causing your the decrease in your tear production.
Talagang ang hirap dahil aside hindi nga siya itchy, pero yun nga namumula siya, and then shadowy yung tingin ko, malabo. Aside from shadowy, malabo siya.
Dry eye affects countless of Filipinos all over the country. However, studies have shown that women have a higher risk of getting dry eye. Most notably, pregnant or menopausal women and women who spend a lot of time in front of computers.
Before, kasi every afternoon, ayun, so parang palagi namumula, tapos masakit, tsaka medyo nagluluha.
You can understand why these call center agents are perpetually complaining of itchy, scratchy, red, sometimes even complaining of blurring of vision. Okay? Because they're usually set in a place where the air cons are turned up very high, it's even drafty, and then for 8 hours straight they're staring at the computers.
People who have dry eye usually experience the following symptoms: a stinging, burning, or scratchy sensation in the eyes, the sense of a foreign substance in the eye, stringy mucus in or around the eye, increased eye irritation from smoke or wind, eye fatigue after even short periods of reading, sensitivity to light, difficulty wearing contact lenses, blurred vision that worsens at the end of the day or after working at the computer for an extended period of time. Many times, people ignore these symptoms and warning signs, thinking that their eyes are just tired. But dry eye is a condition that must be taken seriously.
Even meron akong naka-wear ako ng contact lens or eyeglass, ano siya shadowy. So, ang hirap kumilos.
A person who has severe dry eye can't read for long periods of time, can't watch TV for long periods of time. He's in actual pain when he goes outdoors because of the wind and the dust. He can't even ride a plane because the plane air is very dry. And so he's actually in pain all the time. So these are the things that affect him. So the quality of life of dry eye patients are severely impaired.
You predispose yourself to other infections of the eye because your tear film is naturally laden with antibacterial and immunoglobulins that protects the surface of the eye. You may have what we call punctate erosions of your eye. No? These are defects in the epithelium of the cornea that every time you blink exposes the nerve underneath, and that's kind of painful. Secondly, you invite bacterial infection to set in. No?
Left untreated, dry eye may cause complications. So if you or anyone you know experience the symptoms of dry eye, go to an eye doctor immediately.
The most simple treatment is just to use an artificial tear. But in most cases, the layman does not know how to use them, how often to use them, when to use them. And they also don't know what's causing their dry eye. So the problem just keeps coming back, and so it never ends. So it's really better to see a professional so that they can get the proper advice.
To determine whether a patient has dry eye, doctors run a series of tests that measure, among other things, the quality of tears and the rate at which tears are produced.
They examine you under good light and illumination with the oculars, the doctor, and they try to look for the evidences of dry eye.
One test would be your what we call the tear breakup time. It tests the corneal film, tear film stability. Another one is like a stain to check if there's a presence of devitalized tissues on your eye.
Of course, you may also want to test for the tear production. There is a test called Schirmer's test. There are two types of this, with or without anesthesia. You try to see how much wetting there is in the strip that these patients have. Normally, you should produce about 15 millimeters of tear strip in 5 minutes. So if your patient measures less than that, chances are your patient might have it, no?
And if you've diagnosed the patient to really have dry eyes, then you start them with your artificial tears or your tear substitutes. That's the mainstay of treatment for dry eyes, and it depends on the severity also. You have different grades for dry eye, so you cater the lubricants as to the degree of the dry eye, and you escalate the kind of treatment that they have depending on the degree.
But the more severe stages need anti-inflammatory drugs like steroids, or even fancier drugs like cyclosporin, or some of them might even need a minor surgical procedure just to help their dry eye.
Because dry eye can be a chronic and recurring condition, it is important to follow the doctor's instructions regarding the use of eye drops. Failure to do so may decrease the effectiveness of the medication, and in some cases, may even worsen the condition.
It's very important that when you treat these patients, tell them it's not a magic wand, no? It's not something that when you walk out of my clinic, you'll feel so much relieved. It's something that would require constant follow-up. It's not as if once you take it after a month, then it's all gone, no?
It cannot be stated strongly enough that dry eye is a condition that requires serious attention. So if you or anyone you know experience the following symptoms, go to an eye doctor immediately. And when choosing an eye doctor, make sure that he or she has the proper credentials. For best results, go to a doctor who works at a JCI accredited hospital.
The significance of this is that these are standards that look at safety of processes in the hospital, so that you're sure as a patient that if you come to this hospital with a JCI accreditation, all the processes that occur within that hospital are there for continuous improvement in the quality of care and, more importantly, for enhanced patient safety.
Due to the widespread use of computers in business and everyday life, more and more people are getting dry eye. But thanks to the latest research and newest treatments, more and more doctors are making sure that people with dry eye can still have a refreshing view of life.